Interesting Medical Facts, Part 38. We've had a revolution in cancer treatment for several different cancers in the last 5 to 10 years, with the exception of brain cancer. It is very difficult till this day to actually enter the brain with our medication because of something called the blood-brain barrier. We need the blood-brain barrier. It keeps away things like bacteria that are in our bloodstream from entering into the brain, keeps away drugs or medications that we take from entering into the brain, but that's also the problem, right? If we're giving someone immunotherapy or chemotherapy to try to tackle the cancer, it might not enter the brain. So now we're trying to use nanotechnology, trying to make our cancer therapeutics very small so they can actually bypass the blood-brain barrier and get to the target that we're aiming them for. The next issue we have is that the cells of the cancer themselves in the brain are often heterogeneous. So you might be able to give one sort of treatment that tackles just a small subset of the cancer cells. So you might be able to kill off 20% of the cancer, but then the other 80%, the target was never attacked to begin with. You also don't have time when you're treating brain cancer, because as soon as the cancer unfortunately gets bigger, it's causing functional decline at a much more rapid pace. If you're to have lung cancer, for example, you might have more shortness of breath, you might have more cough, you might have other symptoms, but with brain cancer, as soon as something gets a little bit bigger, you might start having seizures, you might start having less consciousness. So the symptoms just escalate a lot more rapidly, and it doesn't really give you time to treat someone for a longer period. This is genuinely one of the areas in oncology where, I'm a very optimistic person, and I love the development that we've made in so many areas of cancer, whether that's lung cancer, leukemia. This is the area that till this day, it's tough. It's just very tough.